Now, patients with concerns about their mental health will soon be able to self-refer for talking therapies using the NHS app in England. The move comes as new figures suggest that an increasing number of British adults, more than 1 in 5, have a mental health condition. Well, Fay Barker is here with more on this. Fay, making this change to the NHS app, is it going to result in any more patients actually being seen?
Well, good question. Yeah, obviously having access to an app and some of the tools that could present to you would, of course, help some. But it is worth saying at this point, some of this help is already available online via the NHS website, Every Mind Matters. There are tools there to help people with things like anxiety, loneliness and depression. You can already self-refer yourself to talking therapies without the need to see a GP. But back to that point you made, Geraint, about seeing someone face-to-face. Well, to do that, more medical professionals are needed. And at the moment, there aren't enough number of experts to keep up with the number of people who need to see them.
What we need most, I think, is to not forget that severe mental illness requires specialist intervention, and then we can't think of a digital app as a solution to replace the workforce. The workforce has stepped up. We haven't seen the proportion increase in the workforce as compared to the increase in the demand for that intervention.
Well, next Thursday, the government will launch their NHS 10-year plan. And the Health Secretary, Wes Streeton, has already said that they have a target of 8,500 extra mental health workers, and they're already halfway to getting those numbers. But the mental health charity Mind says this plan does need to go further.
It's a really worrying picture from people we speak to at Mind, where people can be waiting weeks, months for mental health support. We've also got more young people now who are living with a mental health condition, which is deeply concerning. We want to see government making sure it's committing to the funding, focus and attention that mental health deserves, so that everybody can get the right support when they need it.
Well, the Health Secretary has recognised how debilitating it can be for those waiting to get more help. And he has said the government is determined to change that. However, for those waiting right now, that help can't come soon enough.